All right, well, good morning, everyone, and welcome. Thanks so much for taking the time out of your day to join us. My name's Tim Admire, and I'm the CEO here at Willow Creek. Today, we have an opportunity to take a deep dive into an important and an often confusing topic, and that's the topic of Medicare. Before we dive in, I do just have a couple of quick housekeeping items for you. The first, please feel free to send in your questions via the Q&A button that's going to be at the bottom of your screen. And at the end of the presentation, we'll get to as many of your questions as we can. And if we can't get to yours, we'll follow up with you after. Second, we're also recording this, and we'll be sending that recording out to you after the webinar. So feel free to share that with anyone who you think might find it useful. So with that, I'm going to turn it over to Willow Creek Wealth Advisor, Rosin Gulick, and she'll introduce our guest today. So take it away, Rosin.
Thanks, Tim. It's my pleasure to introduce Julia Fuentes. Julia has been a valuable member of the Vanguard team since 2008 and has a wealth of expertise in Medicare and healthcare planning with over 20 years of industry experience. We are so excited to have her join us today. So please join me in welcoming Julia.
Thank you so much. This is a topic that I am very passionate about because I think not enough people are planning for their healthcare costs early enough. So today we're going to talk about how do you come up with that number? How do we have any idea what our healthcare costs will actually be in retirement? We're going to walk through the ABCs of Medicare. I'll point out mistakes people make along the way, so you're well equipped to not make those same mistakes. Then we're going to talk about your income and how the income on your tax return can affect your Medicare premiums. And then we're going to wrap up with a conversation on long-term care. So to get us started, there are two buckets that we need to plan for when it comes to our healthcare in retirement. So on the left-hand side, your traditional healthcare costs. You go to the doctor, you get your prescription drugs filled at the pharmacy. These top two line items, those are covered by your Medicare plan. But then there are other out-of-pocket costs that we face that Medicare doesn't cover. And that would include dental, vision, hearing aids. When it comes to dental, a great starting point is to talk to the dentist you want to go to in retirement. They will let you know if they think you should pay out of pocket or if you should seek out an insurance plan and what insurance plans they actually work with. So that's why I say the dentist you want to go to is probably a good starting point to talk about that. Vision care. If you have an eye problem, let's say you need cataract surgery, you're going to be covered by Medicare. What's not covered is your routine vision. I need to get new eyeglasses. I need to get some frames. I need to get contact lenses, an eye exam. That's what's not covered. So when you go to these wholesale stores like Costco, BJ's, you see a lot of retirees at the vision center, at the hearing aid center. It's because of this, because Medicare not covering those costs, people go there to get them filled. Now, this traditional healthcare cost bucket, you don't need to think about this as some big, scary number. You see a lot of news articles that are meant to scare you that say, average American needs $300,000 for your healthcare costs in retirement. But you don't see a news article saying average American needs $500,000 for your food in retirement. So why are we framing healthcare this way? This is just a budget line item. We're going to budget for it. What's our annual expense? What's our monthly budget line item? So we're going to break that down and we're going to plan for it year over year. The other bucket to the right-hand side, long-term care. This is a little bit different because as we age, some of us need help with what they call the activities of daily living. I need help getting out of a chair. I need help going to the bathroom, or some examples. Unfortunately, Medicare doesn't cover these costs. So this is a risk. You might not have any paid long-term care needs, or you might have to go into a nursing home for many years and have high long-term care expenses. So since this is a risk, it's an unknown, Your financial advisor can help you protect you in this bucket. I often get questions on, well, I thought that the government did pay for your nursing homes if you were in there for a long time. And what you're thinking of is Medicaid. And the way I remember the difference between the two, Medicaid aids the poor, Medicare cares for the elderly. So to qualify for Medicaid and get your nursing homes paid for, you have to have very low assets, very low income to qualify. So since we planned, we don't plan to be destitute in retirement, there's other ways that we plan for this bucket to protect ourselves from the risk. So as for Medicare eligibility, you are first eligible for Medicare at age 65. If you are disabled and you're on Social Security disability, you may have qualified earlier, but 65 is the age for most of us. And it's the reason why a lot of people wait until 65 to retire. So if you are retiring, you can enroll in Medicare in the 3 months prior to your 65th birthday month. If you enroll in those 3 months ahead of your 65th birthday, your coverage will start on day 1 of your 65th birthday month. You also have 3 months after your 65th birthday to enroll. That 7-month window around your birthday is what they call your initial enrollment window. This is important because you can't sign up for Medicare whenever you want to. And this is your first opportunity to enroll. And they will look and say, did you enroll in your initial enrollment window? And are we going to assess them a penalty? But you might be thinking, I'm going to continue working, or my spouse is still working and I'm on their health plan through their employer. And I've looked at the plan. We love our health plan through our employer. It's very affordable. It's good coverage. I would prefer to just stay on that and not go on Medicare right now. Can I do that? And this is where there's a lot of confusion, because we want to check with our benefits administrator through our employer just to make sure we have creditable health coverage through the employer. The risk here is if you are a small business owner or you work for a company that is 20 employees or less. That's where the risk is, because small employer insurance typically isn't creditable coverage, which means if you don't sign up for Medicare, you could face coverage gaps and future penalties. But many of us work for the larger employer, more than 20 employees. In that case, chances are your health coverage is creditable coverage, and you can delay signing up for Medicare until later in life during what is called a special enrollment period. What that means is you will get an 8-month window from when you lose coverage to sign up for Medicare without any penalties. Most people coordinate it with their retirement date. Oh, I'm retiring at the end of the year. 2 months before retirement, I'm going to start the Medicare process to have my coverage start on January 1st. You will need to prove that you had creditable health coverage from age 65 on. So if you are delaying and you have one employer, it's pretty easy. Your employer just signs off on a form saying you were covered. If you switch jobs post age 65, it's a good idea to keep a paper trail, knowing that it'll make signing up for Medicare easier later, having that paper trail. So people do this all the time, delaying Medicare until they retire. I would encourage you to price out both options just to see where you get the better value, because everybody's employer benefits are a little bit different, what we pay and what the health plan is. But you might be thinking, wow, she's crazy. Who works past age 65? I'm retiring early. I'm going to retire at 60. Well, oftentimes people have sticker shock, like bridging the gap to Medicare. Well, I can't go on to Medicare until I'm 65. What am I going to do? I'm 60 for the next 5 years. Or oftentimes one spouse turns 65 and they have a younger spouse. Oh, what are we going to do for them for health coverage? Well, step number one, we want to check, do we have any retiree health benefits? Understand your retiree health benefits before you retire. It makes it much easier. Some people unintentionally give up these benefits by not understanding how they work before they retire. If you have retiree health benefits, ask your employer how they work post age 65, because you still need to sign up for Medicare and your plan typically converts to a Medicare plan. Step number two, okay, I don't have any retiree health benefits. It's uncommon. We're seeing less and less employers offer something. So maybe you can convince your spouse to continue to work and you can ride on their health plan. But we know that doesn't always work. Both spouses want to retire at the same time, which brings us to option number three, COBRA. COBRA continuation insurance. What this means is you can continue with the exact health plan you had through your employer, same insurance card, you're used to it. It continues as is. People like it for the simplicity. Your employer can quote the pricing to you because it's different depending on your employer. Everybody's pricing for COBRA is going to be across the board, but many people have sticker shock when they get COBRA pricing because now your employer isn't subsidizing any of your costs. You pay what you were used to paying, what your employer subsidized for you, and an additional 2% administrative fee. So COBRA, since it gets expensive, and also since it's a short-term solution, if you are voluntarily retiring, you can get COBRA for about 18 months. So good for somebody age 63, 64. But you look, you say, COBRA is really expensive. Are there any other options? You may turn to the Affordable Care Act marketplace plans. If you go to healthcare.gov, select the state that you are a resident of, it will bring you to the appropriate exchange. So if you live in California and you're moving to Colorado, you're going to want to look at the Colorado exchange. But healthcare.gov, it's your one-stop shop to select whatever state you're a resident of. It is important to do income planning with our financial advisor. Through the end of 2025, we're at elevated subsidy levels, which means if we can keep our income low enough, and when I say low enough, if you are married filing jointly, and if we can get our income $240,000 or less, most likely you're going to qualify for a premium tax credit to lower your monthly premiums on these plans. It's important because the Affordable Care Act plans get more expensive as we age. So at age 64, they're going to be quite expensive. And if we can income plan down, we can save a lot of money on our monthly premiums. But if we can't get our income low enough and we don't qualify for subsidies, many people turn directly to private insurers. Like, I'm going to go directly to United Healthcare, see if they can give me a better network, some incentives since I'm paying the full boat. So maybe you go on Medicare, we might have to have your spouse who's younger on the Affordable Care Act for maybe a couple years, or private insurance. So now we're going to jump into the ABCs of Medicare, what we call Medicare's alphabet soup. Part A. Part A is your inpatient hospital coverage. You got admitted to the hospital. This is the one part of Medicare that is free. It's free to those who have paid into the system for 10 years or your spouse has paid in for 10 years. Since it's premium free, most people are going to sign up for Part A at age 65, even if you are continuing to work and you're going to stay with your employer plan. Because why not? You're getting additional coverage for free in case you get admitted to the hospital. There is a reason you would not sign up for Part A, and that would be if you want to contribute to a health savings account, by signing up for Part A, you have disqualified yourself from putting any more money into your HSA. You can still spend your HSA dollars, you just can't contribute any more. Also know that taking your Social Security benefits comes with Part A, so that also would be the end of the road for your HSA. So if you don't have an HSA, sign up for Part A at 65. Part B, this is anything outpatient. It's all your medical. I go to a doctor, a specialist, I get chemotherapy. Part B is the one that comes with a cost. The minimum that anybody's paying in the country this year in 2024 is around $175 a month. Once you start taking Social Security, your Part B premium gets netted right out of your Social Security check. No way to avoid that. If you're not taking Social Security, they bill you quarterly. You can set up automatic payments. People that have taken their Social Security benefits more than 4 months before their 65th birthday, you are the only people that will get automatically enrolled in Part A and Part B. They will send you your Medicare cards a couple months in advance of your 65th birthday. Everyone else who has not turned on their Social Security benefits has to take action and enroll. They don't send you a letter with instructions, unfortunately. Part B is the one that comes with permanent lifelong penalties. So let's say you're that small business owner and you don't sign up for Medicare at age 65 because you have health insurance through your small business. Why would you sign up? And then at age 70, you retire and you decide to go on Medicare. There's a 10% penalty for every single year that passes that you could have been signed up and you didn't. So in that case, it would be a 50% penalty tacked on to Part B forever. You can't reverse that. But more like very commonly, I have people that work for the larger employer. So I work at Vanguard. I'm turning age 65. And I say, you know what, this health insurance plan is really great. I want to stay on it and I'm going to sign up for Medicare later when I retire. I can delay Part B. I don't have to pay for Part B and pay for my large employer group health plan because I have creditable coverage. So I'll delay Part B and I'll sign up for that when I retire. So people do this all the time. Also, that same thing goes for your spouse who's on your health coverage. Now, Part D, D is for drug. Everybody takes different drugs, goes to different pharmacies to get that filled. So there's a lot of different drug plans available to you. Now, Part D, my mother, her premium is 50 cents a month this year. If you take a lot of drugs, your premium could be $200 a month. So wide swing in premiums, all dependent on your prescription drugs. Part D also comes with a late enrollment penalty. So if you don't have a creditable prescription drug plan through your employer, you would get a late enrollment penalty if you opted out of Part D at age 65. I often get asked, well, I don't take drugs, so do I really need a drug plan? You can pay a low premium now, or at 80, when you start taking a lot of prescription drugs, they're going to tack on that late enrollment penalty. There's a 1% penalty for every month that passes after age 65, and that penalty is based on the national average monthly premium, which in 2024 for Part D is around $35 a month. Now, the combination of Part A and Part B, this is what they refer to as original Medicare, and you are allowed to stop there. About 10% of the population in America stops there, so most don't, and here's why. There are unlimited out-of-pocket costs associated with original Medicare, and to simplify it, it's 20% out-of-pocket. So you need to get a $50,000 chemo treatment, you owe $10,000 out of pocket, and there's no limit on those costs. So most people say, wow, I don't want to be uncovered like that in case something catastrophic happens. So people that have retiree health benefits through their employer, they can use those retiree health benefits that they come through and can cover those costs. Retired military veterans who have TRICARE for life, that can cover those costs. And also that small employer insurance, you work for that small employer and they have a health plan, but it's not creditable. You can use that health plan to cover those costs. But for most of us, we don't have those three options. Our options are, do I go with Medigap, also called a Medicare supplement plan, or do I go with Medicare Advantage? You don't pick both, you pick one avenue. So we're going to talk about Medigap first. Offered by private insurers like Aetna, Humana Gold, Cigna, United Healthcare, a lot of different private insurers. So Medigap covers the gap in coverage if you just had Part A and Part B. What people like about Medigap, you can go to any doctor in the country. If they accept Medicare, they take your insurance. So wide coverage network. No pre-authorizations, pre-approvals. So it's more of the like Cadillac coverage. I'm going to point out the risk and the mistake I see some people make. First time you sign up for Part B, you will get a 6-month window to sign up for a Medigap supplement plan with no medical underwriting. After the 6-month window, they do full medical underwriting to determine your premium. They can deny you coverage. So for some people, the first time they sign up for Medicare is the last time they will qualify for a Medigap policy. So we want to think about this hard just in case, because you can get boxed out of this. There are some states like the state of California that have adopted something that they call a birthday rule. So this is all state specific. What they want to do is their healthcare rules. But the birthday rule is, okay, so you selected Medigap. Once a year around your birthday, we're going to let you shop your prices with all the different insurers with no medical underwriting. But the catch here is, if you don't have Medigap and you chose Medicare Advantage, there would be underwriting to get into this avenue. So still a risk there, but there are some states that give you additional protections that you can shop within the plan and have the insurance companies vie for your business, you know, annually around your birthday. So Medigap, you've chosen the route of, I don't want to deal with networks. I just want to pay up to get great coverage. Well, the federal government regulates this. They set the letters with the benefits. The benefits you're looking at are the out-of-pocket costs you would face if you just had original Medicare. And keep in mind, just for clarity here, Medigap Plan A is not the same as Medicare Part A that we just talked about. So you can see why this is very confusing. Well, I'm going to simplify this chart. Medigap C is in Charlie, Medigap F is in Fantastic. These are closed to new enrollees to Medicare. Medigap G is the most popular Medigap plan as it stands right now for people selecting Medigap. Around 55% of people selecting Medigap choose Medigap G, the really great plan. 40% of people choose Medigap N, the really nice plan. So that's 95% of enrollments. You know, F is in Frank, C is in Charlie are closed. And this one is the one that exists today that gives you the most benefits. After you meet a $240 deductible, all of your other out-of-pocket costs are covered with Medigap G. So my mother in the state of Pennsylvania, in her mid-70s, she's paying $175 a month. She could get Medigap N for a lower monthly premium, like $135 a month. lower monthly premium, but if you pick N, the really nice plan, you have a small copay to go to the doctor, a copay to go to the ER, and they won't cover something called Part B excess charges. There are some doctors that think they're worth more than the Medicare negotiated rates. They are legally allowed to bill you an additional 15% above the Medicare charge. If you're an N, they can pass that along to you. Since it is very uncommon, a lot of people say, my doctor doesn't charge excess charges. I'm going to accept that very small risk, and I'm going to pay a lower monthly premium and pay a small copay. So those are the two most popular. I'm pointing out the most popular just because this is private insurance. So the more people that sign up for one letter, there's more demand, and sometimes the insurance companies vie for your business and the pricing gets pretty competitive. So hence why I'm pointing them out, because you might look and say, why is the premium on K higher than G? You sometimes will see that and you're like, that makes no sense. And most people, their decision tree comes down to one of them. I do see some people select A depending on the pricing that's coming back in their state. I do want to mention that Medicare covers you in the United States. So if you're going to go live in a foreign country, just know you may have to seek out foreign travel health insurance or find a Medicare Advantage plan with some kind of foreign travel incentive added on to it. So we're going to talk about Medicare Advantage next. So we just talked about original Medicare. You add a standalone drug plan, you add a Medigap supplement plan such as Medigap G, and you're getting your worst case scenario protection. I can go to any doctor in the country. If they accept Medicare, they're going to take my insurance. No pre-authorizations, pre-approvals. Your other option you can go down is you still need to sign up for Part A and Part B. My original Medicare is my baseline coverage, but I'm also going to sign up for Part C. Part C and Medicare Advantage is the same thing, means the same thing. Most people call it Medicare Advantage. What's confusing here? The same private insurers that offer Medigap also offer Medicare Advantage. So you're like, oh, I have Cigna. It could be a Cigna Medigap plan, a Cigna Medicare Advantage plan. So that messes with your head a little bit. And Medicare Advantage is the only one that markets to you. So when you turn 65, you're going to get 30 plus mailers for Medicare Advantage every year for the rest of your life. And why is that? Medicare Advantage is the most lucrative business line for insurers. When you enroll in a Medicare Advantage plan, the government pays that Medicare Advantage insurance company a fee for taking you on as a participant because they will be covering your claims when you go to the doctor and the hospital. For every new enrollee they get, their financial ratings as an insurer can improve. And if you have high financial ratings, you can get additional financial incentives paid over to you. So it's a numbers game. What can we do to get people to enroll? There's never medical underwriting, regardless of the state that you live in, for Medicare Advantage. You can always get into one. Medigap, there's medical underwriting, except for the states of New York, Connecticut, and Massachusetts. So what do people love about Medicare Advantage? The incentives. I can get 0 monthly premium. A gym membership, they're paying for my pickleball court. I can get vision, dental, a toaster oven, dinner with a celebrity. You've all seen the commercials. They're all very unique. How do we get people's attention to sign up? So people love that. They can get very affordable coverage and incentives. What do people complain about? The network of doctors. We need to really understand what is my network of doctors. Some Medicare Advantage plans have national networks. Some of them are HMOs and they're closed networks. So you really have to look and say, Okay, I live between 2 states. Am I covered in both states with doctors? So research the network. The other thing people complain about is authorizations, pre-approvals. Oh, I needed to get a knee replacement. I had to wait 6 to 9 months to go through all those authorizations. So that doesn't bother a lot of people. They say, I've been dealing with networks and authorizations my entire life. Why would I change that now? So not knocking that, they're just different. Do you want to pay up for a monthly premium, pay $100 to $300 a month for that Medigap coverage to not deal with it? Or are you willing to deal within a network and have 0 monthly premiums? Every Medicare Advantage plan must set a max out-of-pocket limit, and it can't be more than around $9,000 for in-network service. So you're protected from those unlimited out-of-pocket costs. But there typically is going to be costs associated with your care. So if you don't really have a lot of healthcare needs, you could pay really little. But in a year where you have something big happen and you require a lot of care, it might drive you up to pay your max out-of-pocket limit. So here's where I like to pick on my mother because it's just so easy to do. So my mother has Medigap G. She spends about $175 a month. In a lot of states, these Medigap plans are priced on your age. So they get a little bit more expensive as you age. But in some states, they do it a little bit different, and they do it off of your age when you first get the Medigap plan. But a lot of states, it's going to get a little more expensive the older you get, not really wide swings. But she's in her mid-70s, $175 a month. She doesn't like paying that because she's healthy. But she gets in one accident a year, and that accident's usually something pretty big that is very expensive. So I'm going to use, just because it's an interesting one, I'm going to use her accident from 2021. She gets bitten by a recluse spider. And we don't know that she's bitten by a poisonous spider. We just think it's an insect bite. So she goes to her primary care doctor and they send her home with an ointment. They don't know what it is. Couple days later, she goes to the ER. It's really painful. They just think it's an insect bite that has gotten infected. Let's give her an antibiotic. So they give her an antibiotic, send her home. She takes the antibiotic for about 10 days and it's not working. Now she's really sick. The poison's deep into her body. And with these spider bites, where they bite you, it actually, eats into your body and makes a hole. So now she has a hole in her chest and it's serious. So we were able to look up specialists in the state that specializes in insect bites, and we were able to get in to a dermatologist right away. This dermatologist that we got into did not accept Medicare Advantage, but she accepted Medicare, so they took the insurance. Within 5 minutes, they diagnose her. She goes to the hospital for 20 days. She needs reconstructive surgery on the hole and a year of dermatologist visits. What did that cost her? After she met her small Part B deductible, she had her $175 a month and it was all covered. Now, let's say she had had Medicare Advantage that year and she had 0 monthly premiums. Okay, she goes to her primary care doctor. Maybe that's $30 copay. The ER, maybe that's $100 copay. Well, we'd have to find a doctor in network that specializes in insect bites. We couldn't have gone to the one we went to. And the surgery alone would have brought her up to her max out-of-pocket limit. Let's say that was set at $7,000. She would have spent $7,000 that year versus $2,000. But now flash forward to 2024. We haven't had an accident this year. I'm not really sure how we got through so far. I mean, there's still time, but this year, she's actually spending more for her Medigap coverage. She didn't really go to the doctor a lot this year. So she spent $2,000 for her Medigap coverage, and she probably would have been a couple $100 in with the Medicare Advantage plan. So you can see how your healthcare needs can affect that, and it can change year over year. So just different coverages, but that's what you need to decide between. So to bring it all together, oftentimes your advisor will budget with a Medigap G just to throw something into your financial plan to give you that, all-encompassing coverage. So Part A, we talked about how hospital is free. Part B, nobody can escape the $2,100, comes right out of our Social Security check once we start claiming. Part D, drug plans. $420 is the national average monthly premium. I talked about my mother only pays 50 cents a month. This is going to be different for everyone. Plus your out-of-pocket drug spending. Come 2025, due to the Inflation Reduction Act that was passed in 2022, they are capping our out-of-pocket drug spending on Part D plans at $2,000. That starts next year. It's a big change for Medicare. And that's going to help a lot of people that have been complaining about what they used to call the donut hole. People that take a lot of prescription drugs and were spending a lot on their drugs. Then for Medigap Plan G, it depends where you live, what this is going to cost. It depends. Hey, the first time you signed up for Part B, did you get in without the medical screening, or are you trying to get in now and you have a health condition and they're going to price you on the high end? So it's, really depends on a couple of those variables. Also know that you're living in Texas and you're paying $100 a month and you go to move to be closer to the grandchildren in New York. Your $100 a month premium could increase to $282 when you're in New York. Where you live matters with these costs. Now there's one more variable that's going to make you groan a little bit, but it is how your income rounds this out and plays into this entire equation. So on an annual basis, the Social Security Administration is pulling your tax return from 2 years prior. So your 2024 Medicare premiums are based on your 2022 tax returns. So let's say you're on Medicare today. Come November, you're going to get a notice saying your 2025 Medicare premium is based on your 2023 tax return. So always the 2-year look back. What are they looking at? Modified adjusted gross income. If you pull out your 1040 tax return, we're going to look at your adjusted gross income from line 11, and we are going to add back in your muni bond interest from line 2A. So we're not safe with municipal bonds here. They include that in this equation. And oftentimes I get asked, what's in AGI? What's included in there? A lot of things. So your pension, a lot of us, 85% of our Social Security is taxable. Dividends, capital gains, and that includes, hey, I sold my vacation home and I got this big capital gain. That can inflate your Medicare premiums for a 1-year period. Maybe you have like rental income. All your income, you start taking RMDs at age 73. That's going to affect this. A lot of people, they don't realize how high their RMD is going to be. And then once they start having to take that, it inflates their Medicare premiums. So some people get some IRMA surprises here when they do things like, oh, I'm doing a Roth conversion strategy post age 65. And the amount that they're converting to Roth is inflating their Medicare premiums. Think of this as an additional tax. Maybe you receive an inheritance from your parents and you have to liquidate it over a 10-year period. That can affect this. So the point of the matter here is, work with your financial advisor on income planning, because there's little things we can do. Some people, there's nothing you can do. You're stuck. Your income is $1 million a year. Like, you're never going to be able to get below. but your advisor can work with you to see if there's anything we can do to reduce this income. The way we donate to charity matters. Sometimes we don't want to just write a check. There's another way we can give to charity to reduce this surtax. So one last thing to mention here. Let's say you are somebody that in 2022, you were fully employed, you worked full time, and between you and your spouse, your income was $500,000. Now in 2024, you retired in January, and your income this year is $200,000. What are they going to do? They are going to charge you too much for your Medicare premiums for 2 years, waiting for your tax returns to catch up to you. You don't need to pay that. If you've retired and your income is permanently lower moving forward, there's an appeals form to tell the Social Security Administration, I had work stoppage, I had work reduction, and they will lower your Medicare premiums. Oftentimes we see retirees in this situation and they pay too much their first 2 years in retirement. And then they go, oh, my Medicare premium went down. Cool. Well, you didn't have to pay that the last 2 years, and it can be pretty significant savings. So to wrap up with long-term care, we talked about how long-term care is not covered by Medicare. They cover you for 100 days in a skilled nursing facility if it is following up to, let's say, a hospital visit and you are improving in health. After the 100 days, you're on your own. It depends where we live, how much this is going to cost. And unfortunately, there's a risk, especially for women, because of longevity reasons, that you might need paid long-term care for more than 5 years. My grandmother had Lewy body dementia. She had no paid long-term care because my mother quit her job to take care of her. So some people have a lot of family support here and they don't have to have paid long-term care. But if you don't have family support, the risk here is that 15% of retirees can expect to pay more than $250,000 in this bucket. Many people need around $100,000. So this is very customized of a conversation. Your advisor will help you decide what to do. All right, here's the risk. Here's the costs in our area. Should we self-insure, set money aside? Should we look at insurance policies to protect us? There's a lot of interesting life insurance policies with long-term care riders out there these days. Your advisor can help you decide what you should do, if anything. So what I want you to do with this information on an annual basis, sit down with your advisor and do income planning. It's a good time to do that at year end. We have a little more idea of how the year is going and see if we can reduce some of these costs. Share your insurance policies with our advisor so they know how we're protected, and then budget for your healthcare costs on an annual basis. Once you go on Medicare, you're going to have homework. Once a year, October 15th until December 7th is what they call Medicare's open enrollment. All this means is this is your one time a year that you can change your drug plan. You can change your Medicare Advantage plan. So that's what open enrollment is. Drug plans, Medicare Advantage. If you do nothing, your plan rolls into the next year and you're stuck with it until the next open enrollment. Why that's a risk, not reviewing your plan. Formularies change. And what that means in English is your drug might not be covered next year. So we have to change our drug plan to get our drug covered. So they do change formularies. Also, pricing changes. My mother last year, if she had not changed her drug plan, she'd be paying $130 a month instead of 50 cents a month. She doesn't take a lot of drugs. So it matters to look at the plans, especially with Medicare Advantage, because we often see doctors leave the network. So If your doctor left the network and you didn't change your plan, you might have to change your doctor. So brokers that sell these Medicare plans oftentimes will do this automatically for you if you're working with a broker. Also, Medicare has something called Plan Finder online that you can shop these plans on your own. So lots of different avenues to work with a broker. Your state health insurance program, you can find the phone number in the Medicare handbook. So lots of options for help and guidance on what direction you should go with and help on shopping your plans. If you don't have healthcare directives, you want to get your affairs in order. We can all get incapacitated at any time, and we want our families to know our wishes. Who's our healthcare proxy? And then if you're still working and you have access to the health savings account, you can fund most of these costs in retirement tax-free using HSA dollars. So I know that was a ton of information. We can certainly share these slides with you, but I will stop sharing and we can address any questions that have come through.
Thank you so much, Julia. That was awesome. I can't, I'm always overwhelmed with how much information there is about Medicare and trying to keep everything straight. So really appreciate you, being so clear and thorough. Couple of questions just to kick us off here. I'm not clear about open enrollment in Medigap versus Medicare Advantage. Is there nothing to do if you're on Medigap except Part D?
Yeah, so if you're on Medigap, your only homework during open enrollment is to check your drug plan, because most people choose a Medigap plan and stay with it for long periods of time. It's a long-term decision, and you can change your Medigap plan, drop it, and enroll in one throughout the year. But of course, we talked about earlier the medical underwriting. So if you miss your initial window, that would come with medical underwriting. So open enrollment is all about drug plans and Medicare Advantage.
And so with Medicare Advantage, you still have to choose your drug plan.
So usually Medicare Advantage, the drug plan is wrapped into it. Okay. So when you talk to a broker, you're pricing it out online, they'll ask you, what drugs do you take? And you can go, what doctors do you go to? And it'll match you to the right plan that, gets the coverage that you need. So typically, you don't have a standalone drug plan in a Medicare Advantage plan. And I said typically, because maybe like 5% of Medicare Advantage plans don't include drugs and you would need the standalone, but most of them have the drugs in the plan.
And just one last thing on this topic. We have a lot of clients that are on Kaiser's Senior Advantage, which is a Medicare Advantage program. Is there anything for them to decide at open enrollment, or is that just kind of a bundled up Kaiser program and it's kind of, that's what you get?
Yeah, so I think you would still review it just to make sure. And what they are legally required to do is they send you a notice in September with your plan changes. They call it notice of change. A lot of people just throw it out because it's a little overwhelming. It's usually like a big packet and they're like, notice of change. It's kind of like getting a prospectus in the mail. Like, do I want to read this? Not really. But that's where it shows you the changes that happen year to year. I'm assuming with the Kaiser Senior Advantage, they probably keep it pretty consistent, that you're not seeing major changes. So probably people just stick with it year over year. But it's always good to do a quick review, especially if for some reason you started taking a different drug and you want to check, hey, maybe there's another plan that, like my aunt started taking a very expensive drug called Creon, and she had to change her Medicare Advantage plan to find a plan to make that all more affordable.
It's a lot of management. Tim,
they
any questions?
They like to keep us busy in retirement. Got to keep us busy.
Yeah, Ross, and I've actually got quite a few here. So I'm going to start off with one for you, Julia. And you mentioned a little bit about HSAs. Can you talk about medical savings accounts? And are those something that are available to everyone on Medicare? How do those differ from HSAs? How does that work?
Yeah, so the medical savings accounts are very similar to an HSA. So when you're on Medicare in some areas, depending on where you live, you might have this as an option. Not everybody does, but I think of it just like an HSA where you can get some tax advantages, very, very similar, where you have, a Medicare Advantage plan with that attached to it. So they are very similar, something you can do during Medicare, but to be honest, they're not like extremely popular. So we see like pretty low utilization, but part of that has to do with it not being available everywhere.
Great. Great. Thanks, Julia. And if you have questions, feel free to drop them in the Q&A box, and we'll get through as many of those as we can. I see a number of questions coming in. Some of these are very specific. Some of these we may follow up with you directly on after the webinar. But again, feel free to drop your questions in there and we'll get to what we can here in the next few minutes. Julia, I've got another one here. This is in regards to changes to Medicare in 2025. So you mentioned a little bit about that, but just curious if you could expand on what those changes are and sort of which ones of those you see as positives and those that you see as negatives.
Yeah, so going into 2025, the drug reform, they started this back in 2022, where and a lot of people miss this because it was packaged in some big bill called the Inflation Reduction Act. But what they said is, hey, there's people out there that are not taking their cancer treatment drugs because they're too expensive. And we don't want that to happen anymore. So let's pass some reform and cap your out-of-pocket drug spending. And it just goes into effect in 2025. They started negotiating drug prices, which means they are picking the most popular drugs that Medicare covers, and they're going to the company and they're saying, this is what you're going to charge. If you don't charge this, face this tax penalty. So they're negotiating prices of these with these pharma companies. Now with 2025, 2026, it's kind of too early to see how this is going to play out. Because of this drug reform, we may see more swings in premiums on drug plans come like 2026 as they sort out like all the funding and how everybody's going to make money off of things. But it is a positive thing for retirees that couldn't afford their drug coverage. But you want to keep in mind, not all drug plans cover all drugs. That's why we have to just to make sure, how is our drug covered? And that $2,000 out-of-pocket drug spending does include your deductible too.
Julia, that actually just reminded me of something that I've been learning about, which is this cost plus drugs from Mark Cuban. Do you know anything about that? And do you know if Medicare is working with that program to lower the cost to people who are taking these medications?
Yeah, so it's interesting. I have some people that have the Part D drug plan and they can't find a drug plan that covers their one medication. And they'll go through things like Mark Cuban, or you might have heard of something called Good RX. It's like the, discounted drugs, and they'll buy some of their drugs through, Good RX, and some of them through their Part D drug plan. So although your drug plan spending on Part D will be limited at $2,000, you might be getting some of your drugs outside of that drug program. A great place to get information on this is your pharmacist too. Going to your local pharmacy, CVS, they can really get into the details on like how you can save on your prescriptions.
Great. Tim, any questions from your side before?
Yeah, I've got a couple more here we'll try to fit in. So one of these is a bit of an example, but I think it's a good question. So husband and wife. Husband is 66 and retired. Wife is still working and covering the husband under her insurance. Does he need to sign up for Part B right now, even though he's covered under her insurance, and also want to try to avoid any penalties that might be involved?
Yes, so if she has creditable coverage through her employer, so typically you work for an employer with more than 20 employees, it's creditable. He does not need to sign up for Part B. He can delay until she retires, and at that point in time, they'll both go on Medicare at the same time.
Great. One more question here. This individual has a Medigap plan. The question is, can the Medicare plan finder help find a less expensive plan with the same advantages? And if not, what's the best way to analyze that?
Yeah, so I see a lot of people work with a Medicare broker, like one, just to give you a name out there, Boomer Benefits. I know they have a funny name, but they do a pretty good job. That's a national broker that works with every state except for the state of New York. Chapter is another national broker, but they can bring you through and kind of give you the, pros and cons of insurance companies. But I'm somebody, I know I'm more interested than the average person. I like to look on Plan Finder and just look at the plans before I talk to someone, because then you can think of questions that you want to ask them and you've already researched them a bit. So Plan Finder is a great starting point to see your baseline. You enter in your drugs, and it's going to give you the details. And then you talk to somebody, either a broker or the state health insurance program, and they'll answer all your nuanced questions and you can talk to them about your health situation.
Great. Rawson, I think we have time for one more, if you have some more in your queue there.
Yeah, so I think, Julia, because it is such a topic, the Medigap versus Medicare Advantage, do you have, like, when one is deciding between which direction to go, do you kind of have like the top 3 things that you need to consider, just as the last point to leave people with, so it's top of mind?
Yeah, so it's really the consideration is, how much flexibility do you want with doctors? So flexibility, network, your, cost certainty, or like, would you like to pay a monthly premium regardless of what it is and know if you're covered? Or are you willing to say, hey, I have $6,000 as the max, and like, I'm comfortable with that and I'll pay as I go. So it's really flexibility of doctors, your out-of-pocket cost range, and the risk, really just the risk with Medicare Advantage is that your doctor decides not to accept Medicare Advantage anymore and you have to switch. We saw that in California last year, a big medical practice up near San Francisco. They had 30,000 Medicare Advantage participants that they just stopped accepting all Medicare Advantage plans, and they went to just accepting Medicare, and all these people had to flurry to find new doctors. It doesn't happen that often, but that's the kind of stuff you see in the news. So it's more, Medicare Advantage is more popular than Medigap. So we do see more people go in that direction, probably because of the incentives and the marketing. They do a good job.
Thank you. Thanks for that.
So we didn't quite get to everyone's questions, so I apologize for that. But if you have other questions, please don't hesitate to email us, contact your advisor. We're happy to help you with some of these things, especially some of the more specific questions that some of you had posed. But wanted to close out and just say thank you very much to Julia for sharing your time, your expertise with us today. This was awesome. And just a reminder that we'll be sending out the recording in the coming days of this. So you'll have that available if you want to reference it later. And we'll also have it on the Insights blog on our website. So on behalf of Rawson and the entire Willow Creek team, I want to thank all of you for joining us this morning. And I hope you all have a wonderful afternoon. Thank you.
Thank you.